Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. What started as all things related to brain health and wellness has morphed into largely brain injury health and wellness, with occasional other neurological topics. My mission remains the same, to help you on the path to a healthier brain. So, without further ado, let's get into the show. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is April Ildvad. April is a licensed mental health therapist in Montana and Minnesota. She is a certified brain injury specialist through the American Brain Injury Association, a board member of the Montana Brain Injury Alliance and the Governor's TBI Advisory Board, and she is also a 27-year brain injury survivor. Thank you so much for being here today, April.
It's my pleasure. Thank you for inviting me, Mandy.
Of course. So, my first question to everybody when they come on is just kind of tell us a little bit more about how you got to where you are. We got a little teaser in the bio, but how'd you get to what you're doing now?
Okay, so starting off in 1999, I had a plum-sized non-cancerous brain tumor that was dismissed by one doctor as migraines, and I was given Imitrex, and he said, go on and just live your life. I was 24, so I was kind of not naive, but trusted doctors. And so I had a couple more different types of headaches, and I was like, this just doesn't feel right. And so I went to another doctor, and that doctor ordered an MRI, and that was a Wednesday night. Thursday, they called me and said, you need to come to the hospital right away. You have a small growth on your brain. And I, at that time, didn't know anything of what that one meant. And proceeded to have brain surgery, removed the tumor, had complications from medication, and was in a coma for a week. Yeah, it was interesting. My husband said that after the surgery, I was fine. I was doing really well. And then after the complications with the medication, I came back as a different person and struggled with a lot of rage, a lot of impatience. And my kids were 10 months and 3 at that time. So they were little babies. So our lives just turned upside down. I was working full time, had to stay home after that. Very isolated. And then about 5-6 years later, after several different other medical issues, I started volunteering with the Minnesota Brain Injury Alliance, and it was amazing because I found my people, started doing Tuesdays at the Capitol, which I absolutely loved, and met a lot of fantastic people, and just was really active within the brain injury population and community there. And then I saw the need for mental health support because a lot of times the physical symptoms of brain injury are worked on, but the loss and the grief and the changes in personality are kind of, in my opinion and in my experience, dismissed or not acknowledged. And so I decided after when my kids were older that I would go back to school and become a mental health therapist. And my focus and expertise, I guess you could say, is on helping people with brain injury. I also work with a lot of people with significant mental health issues. So I get all of the fun people that struggle really hard and are really misunderstood. And it just is such a pleasure to be able to see changes and have them understand how their brain injury is affecting them, even if the brain injury first was like 10-15 years ago. Because mine is 27 and I'm still struggling with some of the symptoms. They're better, but they haven't gone away. They've changed over the years, but they haven't gone away. And so being able to sit on both sides of the fence, so to speak, of living with a brain injury and then helping people navigate what brain injury is like and the mental health part of it is such a pleasure and such an honor. It just, I love work. I love what I do, and I am so privileged to be able to do it. And then I get to meet all sorts of different people, both professionally and, privately. So it's just fantastic.
Yeah. That it is a unique experience, kind of being on both sides of the stethoscope, as I call it. So you being the patient and the person helping other people that have been in those shoes as well. And having a tumor on your brain is a brain injury. We often don't think about it that way, but anytime we cut into the brain, we do something to the brain, it can create brain injury, even if it's not like the injury itself. So it's a lot of people kind of miss that part. And I do have a lot of patients that come see me that have acquired brain injuries of different types, that it's not always traumatic. I've had patients wake up from brain surgery and they have the same symptoms as somebody who had a concussion. They just hit their head in order to create it. So
Absolutely.
those things are still definitely there. So thank you for sharing your story on that and what you
Yeah.
went through.
Yeah.
Curious if you can share a little bit more about the resources that you needed to recover in that kind of the acute phase and kind of what got you a little bit more functional, I guess.
So I didn't receive anything.
Goodness. Okay.
Yes, my neurologist told me after I left the hospital that I did not have a brain injury. There was nothing wrong with me and that it was all in my head.
I mean, well, he's right about something. It was in your head, but
Yeah,
because
yeah,
your brain is
absolutely.
inside your skull. But yeah.
Yes, yeah. Well, and I have a hole in my brain because
Mhm.
the tumor was on my parietal lobe and sitting on top of my head. So I have a literal hole in my brain that dips down and there's scar tissue there.
Mhm.
And anybody that knows anything about brain injury, you damage your brain and you damage your brain. And back in 1999, the idea was that once you damaged your brain, that was where you were at. You weren't going to make any progress. You weren't going to make any the recovery was very limited. And also she was very dismissed. Again, I was very young, I was 24 and didn't know anything. And so she said I wasn't having seizures, which I was. I had partial seizures. And she said that I didn't have any brain damage. So I needed just to move on with my life, continue with my life. Didn't have any therapies, didn't have any support. And my neurologist was very dismissive. So I did a lot of recovery stuff on my own. I taught myself how to crochet. My first blanket was very wavy. The edges were not clean at all. But I've been doing it ever since. And then I started doing probably Sudoku close to 5 to 7 years afterwards, because I knew that I have a problem with sequencing, and then I've done puzzles, just regular picture puzzles with my kids. So a lot of their growing up, we did a lot of things that as they learned, I was helping them, and it was helpful for me too. But long answer, long.
Yeah.
I didn't have any resources. I had no support.
Yeah.
I had nothing. And that's again one of the reasons why I went into mental health is because of my own issues that I had with my doctor. And luckily I switched neurologists like 2 or 3 years after I was injured or got sick. And found a fantastic neurologist who really supported me. And we did we did a sleep deprived EEG, and that discovered the huge
Seizures.
amounts of seizure activity, which was very, very validating in that moment of I'm not crazy. I'm not making this up. These symptoms are real. What I'm experiencing is real.
Yeah.
And went on medication that was actually helpful and didn't just fry my brain. So, but yeah, again, I didn't get anything.
That's crazy to me, but also common,
Hmm.
unfortunately.
Hmm.
I hear that story a lot. And even now in
Hmm.
2026. So we're not in
Yeah,
1999 anymore.
right.
We're in 2026. You would think that everybody would get the treatment that they need, but it's still not there.
Hmm.
So you were in Minnesota at the time
Correct.
that it
Yes.
happened, but
Yes.
you're in Montana now, a little bit more
Yes.
rural. What's the difference between rural care and metropolitan care?
Oh, I almost said oofta.
I'm still in Minnesota. You can say oofda. I say it
Yeah,
all the time.
I still say oofta. Comes out. So I think population wise, Montana is one of the most rural states in the union. The amount of deaths per capita here is extremely high. We rate between second and third per capita brain injury deaths. And we toggle in between Alaska and Wyoming, which makes sense. Very active outdoors
Mhm.
states. The biggest difference that I see is one, there's hardly any providers here. There are maybe 2 neurologists in Bozeman, which is the biggest city that I live next to. Hospital time to get to is anywhere from 30 minutes to 45 minutes on average, depending on if there's an animal on the road or construction. And then also in the wintertime, because a lot of times going over mountain passes, it just takes a lot longer. So providers are lacking here. We had a hospital in Bozeman, their complete neurology department quit. I think it was in 2022. They're rebuilding it now, and that's really fantastic. But to have a whole department just quit
Yeah.
is not necessarily the greatest. Lots of times people go to Salt Lake City or Seattle for care. Craig Hospital in Colorado is a big one too for rehab. There's just not a lot of providers here, and a lot of people that I've ran into are not as educated on brain injury,
Mhm.
even lower than other states. And it's It's sad because there's a lot of people falling through the cracks, especially because we have such a high population of people living with brain injury, and concussion is a top thing here too. I just attended a meeting a couple weeks ago for the governor's TBI advisory board, and we were going over the statistics, and the statistics here are pretty astounding and unfortunate, and there aren't a lot of providers here that are competent in treating brain injury. So I think that's the biggest difference, is that in more metro areas, you've got a wide variety of people that are competent in brain injury. Level 1 trauma centers are more apt to have more treatment facilities, or sometimes. But yeah, I think just the lack of providers. Again, we have to travel hours to get to people that can help.
Yeah.
I treat one client who has a severe brain injury, and they drove 5 hours to Kalispell from Bozeman to seek treatment for a seizure disorder because they couldn't find anybody in Billings, which is the biggest town in Montana. I think that has like 150,000 people. I could be off on that, but it's not a lot of people.
Oh.
So, and that's a long ways to drive just to get care.
Yeah. Yep.
And cost prohibitive,
Yeah.
because a lot of people with brain injuries are not either working or have lower incomes, and or have to work and can't take off that time. So
Do you know if they use any kind of telemedicine in any of the programs around you?
I use it, so I'm guessing that it is used. Yes, I know psychiatrists that have used it. I know neurologists that have used it.
Okay.
Physiologists. I don't think it is as readily available, but we are a very rural state, so I don't see how those providers can't use it.
Yeah. Yeah. Even in the Twin Cities area, there's lots of facilities. We've got a couple level 1 trauma facilities. I went to a level 1 trauma facility with my car accident, and I was never told I had a concussion. So that's why I kind of rolled my eyes a little bit when you said the
Yeah.
level 1 trauma facility, because it's still not guaranteed that you're going to get the care that you need there. And I've
Right.
had patients, I work in the northern suburbs. I've had patients come from 4 or 5 hours away, northern Minnesota, Fargo,
Mhm.
eastern North Dakota, come
Mhm.
see me because they
Mhm.
don't have another provider close by that can do the same kind of things. So
Yeah,
we get a
absolutely.
little bit of that, but that's not the norm for what I
Yeah,
see.
yeah, and unfortunately, it is the norm here, is that we have to
Yeah.
travel. Yeah, because I live in a rural town, but I work in Bozeman 3 days a week, and
Okay.
so that commute is about an hour every single day that I go there, and, I mean, I'm working there, so that's not a big deal for me. I can
Mhm.
do it, and actually, I
Mhm.
like it, but to drive an hour to seek care, it's just it's hard.
Mm.
And all the stimulation of driving and all the, especially in the wintertime here,
Yeah.
it just hits differently.
Yeah. Yeah. So what are some of those things that you do still struggle with, if you don't mind sharing?
Memory is a big thing for me. Like,
Uh-huh.
I don't remember a lot of long-term. Long-term
Mm.
memory is basically non-existent. Because I'm a mental health therapist, I'd like to say that I'm pretty good at regulating my emotions, but sleep is a big thing for me that I struggle with. Like, I was awake from 3 to 5 last night, for no particular reason,
Yeah.
just awake. I have a chronic headache that could be related to the brain injury, probably isn't. It's a rare headache. But light sensitivity, noise sensitivity, smells are very, very hard for me. And again, I think just the vulnerabilities, when they get higher, I'm less likely to be able to manage my emotional reactions, which is a pretty normal vulnerability. And just being careful of that too, of exerting my energy and being able to manage my energy levels. High fatigue, again, probably going back to related to not sleeping well,
Yeah.
but it just compounds.
Yeah.
And so I give a lot to my clients. So I don't have a lot in the evenings and on the weekends to do, but try to stay active. But yeah,
Mhm.
I think not remembering my childhood or my kids' childhood. Not remembering vacations that my husband and I have gone on. I take a lot of pictures just to try and remember,
Yeah.
but some of that stuff is just gone, and there's nothing I can do about it.
Mhm.
And I think the acceptance piece, the grief too. Some
Mhm.
days are harder than others. But yeah, just all the good stuff.
Yeah.
You
Yeah.
I
But you are successful at work, and
Yeah,
it sounds like you do something that is so very much needed.
yeah.
So,
Unfortunately, yes.
yeah. There are times when I wish we could clone those of us who have had the physical experiences ourselves, because I think we do make different kinds of providers.
Mm,
Like,
I agree. I think a lot of my clients most of my clients know that I have a brain injury. I'm not shy about it.
Yeah.
I disclose it when it's necessary or if it's appropriate. But after a disclosure, I talk about it, and it brings a comfort. And I
Mhm.
check in with my clients to make sure that what I'm sharing is they feel that it's okay. And more often than not, I get, yeah, tell me about your life because it makes me feel normal. It makes me
Yeah.
feel like my experience are real and that I'm not just making them up. And again, I think I'm so privileged to be able to do this job and so grateful because for a long time I wasn't able to work, and to be able to do this like this is just such an honor, and to be able to walk with people in their experiences and grieve with them too, because a lot
Mhm.
of times I get people that are only maybe a year 2 years out from their injuries, and just the losses and how their family treats them
Mhm.
is just unfortunate, and
Yeah.
it's really sad. But I
Yeah.
get to walk with them, and that's really a privilege.
Yeah.
So
Yeah, absolutely. Yeah, like I said, I wish I could clone you and have more people like you, because there's so much mental health involved in a brain injury.
Mhm,
As you mentioned, the grief part of things. It took me
mhm.
almost 2 years to get back to work after my own injury. And
Yeah.
there was a time when I didn't know that I was ever going to be a provider
Mhm,
again. And I didn't know how much I tied my identity to my
mhm,
title.
mhm,
And so that grief was huge. And I do share a lot with my patients as well.
mhm,
So just about every one of my patients knows that I've had a brain injury myself.
mhm.
And they're grateful for that,
Yeah,
because then they know that they can describe things that other people don't understand. And I generally do understand it, because
yeah.
most of the time I've been there. And then they'll ask me periodically, "So this I'm experiencing this too. Is that something you experienced also?" And not
Mhm.
every brain injury is the same. Not everybody
Right,
has all the same things, but I'm able
right.
able to tell them if I did or if I didn't, and what I did about it if I had it. And
Mhm.
even if I didn't, I've seen it in other people, because
Yes.
they're unique in their own experience, but they're not unique in that people experience similar things. And
Mhm.
the thing I find with patients that have a brain injury is that we always have kind of this strange thing that we don't know how to describe to somebody else
Right?
unless you've been there.
Yeah, yeah, yeah. I think that's the most unique thing is that again, I work with several people that have had several severe brain injuries. A few in group homes. One that has caretaker and a guardian that come in with her, and I have been able to look at the caretaker and the guardian and say, "You need to stop doing that. This
Yeah.
is aggravating her brain injury, and she can't verbalize it." And they're like, "We never thought about that. Like
Yeah.
going to 5 different places and then going to Costco. I'm like, you can't do that." No wonder
Yeah.
why she's having a fit. But just talking with her too, we have this sense of humor that we just get, and her guardian is like, "I'm just gonna leave you guys alone." Yeah, it's sometimes working with people, it's they try to explain it and then I reword what they're trying to say and they're like, "Yes, that is exactly what my experience is." I'm like,
Mhm.
"That's normal." Or, "Yeah, that's understandable that you're frustrated with that. It's just we speak a different language and we relate to each other in a way that feels like I don't know, for me, it feels like home. Like I'm with my people. Like
Mhm.
I'm with people that fully understand me. If I say something in a backwards way, or I get my words not in the right order, or I say a word that's not the correct word, because aphasia is just fantastic.
Yeah.
They just roll with it, and they're just
Yeah.
like, "Okay, I understood what you said."
Yeah.
Think about it, I'm like, "Did I even say that right?
Yeah.
No, no, but I still understood you."
Yeah.
And it,
Go
yeah,
ahead.
it's just comforting.
Yeah. There are times when we joke in my house that words are hard.
Oh, words are hard
So
every single day.
we just have that line. Words are hard. There are
Yeah.
times that the words just don't come up. Are there any resources that you've developed or that you find useful when you're working with your patients, your clients?
Oh, that's a good question. So again, I love like word searches, puzzles, Sudoku. I keep my house and my office very scent neutral. If I'm feeling out of sorts, I am also a DBT therapist, so
Mm.
dialectical behavioral therapist. So it's very skills based cognitive. Behavioral therapy. So I integrate a lot of that into my therapy. So grounding skills like the 5 4 3 2 1. I have I am a very big rock person and fossils. And so I have a lot of fossils in my office. So if somebody is capable, they might hold a cephalopod fossil that I have that's like this big and it's very heavy. but it's cold too. And so it's being able to describe those sensations, the body sensations, getting people grounded in their bodies and being able to recognize. One of the things that I've learned when I was recovering is that I had very little patience for any kind of noise. And so I would take myself out of the situation, or I would take some deep breaths. And so just teaching people how to take those deep breaths, how to ground themselves, how to hold an ice pack if you're really, really upset, because that's part of, cooling down your autonomic system. But yeah, I think it's very mind body, being able to recognize when you have low energy and being able to take care of yourself without, I mean, the guilt comes, but without it being so overwhelming that you don't take care of yourself. Just teaching people not to overdo it, because the crash is harder and the recovery is longer. But yeah, I think it's just being centered in your body and being able to recognize those body sensations that are happening that may cause like a blow up or something that you don't want to happen that you have to repair for. It's a little bit different. And I think that because I've experienced outbursts of rage when I was first recovering and didn't understand it, I had to, again, having a baby and a 3-year-old, a toddler, you can't really lose your stuff on them and have it be okay.
Yeah.
Especially being a stay-at-home parent. So being able to manage that and just say, hey, mommy needs a timeout, or I need a break, and taking that time, whether that's going outside when it's winter time, because that helps too. But yeah, I don't know. Am I answering questions? Because sometimes,
Absolutely. Yeah.
brain injury, squirrel.
Yeah.
I'm long-winded.
Squirrels are good. I
Yeah.
have a patient who came in one time and told me that she is the president of the squirrel club.
Mm.
So I have since knighted people as the vice president and the secretary too. So it's all good.
Yeah. Yeah.
It's a club.
Yeah. I love talking about brain injury and educating people. And so this is like my favorite topic, and I could talk about it all day. So
Yeah.
I just want to make sure that I'm being concise too.
Absolutely. Absolutely. I did want to touch on that idea of kind of that body-mind connection a little bit, because I think I've seen this a lot in my patients, and I noticed it myself too, is that after a brain injury, we tend to have to listen to our bodies a little bit more and really kind of pay attention to those signs that we are getting overwhelmed or that we're getting overstimulated. And how do you approach that conversation with your patients, just realizing that they probably are more in tune with themselves now?
I'm kind, but I'm pretty blunt in some
Yeah.
areas. Like if, for instance, the caretaker, and like you can't go to 3 or 4 different places
Yeah.
and expect her to be able to handle the Costco. So maybe you do Costco first, check in with her and see how she's feeling. Because if you ask her a direct question, she's going to be able to semi-answer it most of the time. And you can judge by her answer whether or not she is capable of going to more places. And some days are just rest days. And so being able to do that is very helpful. With people who are more aware, because I work with some people who are just not aware, it's getting that awareness of how do you feel after you do these things? And, or, I'm working with a new guy, and he's like, my wife just frustrates me all the time. I said, is it frustration or is it something else? And he had to really think about it. And I was like, okay, so there's a large range of emotions that we have. And it might just be frustration that you identify because that's what you know. Is there any other like annoyance or irritation or, something else that you're feeling that you might not identify that's not frustration? And just connecting those emotional names with being able to do that. I work with a lot of neurodivergent people too. And so being able to identify emotions is just tricky for them. Which I found with a lot of people with brain injury is just, we stick with one word, and I'm cranky or I'm frustrated, and that's it. But there's a whole wide variety of emotions that people feel, and being able to, again, where do you feel that in your body? Like when I get frustrated, it's in my chest or my ears turn bright red. And I know that I need to take a break because my body just feels like it's buzzing.
Yeah.
And so I know that if I don't take a break, that I'm going to say something that I don't mean, and I'm going to have to repair that relationship because I can get really, really cruel very, very fast. And I recognize that as I've gotten further away from my injury, is that I can't just blow up at people and say, I have a brain injury. You have to excuse that behavior because that's not okay.
Yeah.
And so with clients, it's being able to identify, where does it feel in your body? And then how do you name it? And if they don't have the words, we kind of problem solve with that too. And it's not an easy fix by any means. It's an ongoing thing. And just being able to, again, grief too, naming the grief. Like,
Yeah.
you lost your career and you had to stay home, or you lost all of your friends, which happened to me because nobody wants to be 24 and sitting home with somebody who's bald and has a scar on their head. And because that mortality just slaps you in the face. Just the loss of that is just incredible. And so being able to identify and then identify body sensations is really helpful for most of my clients. So
Yeah. I think that's huge, just being able to identify those things.
mm,
And sometimes patients find it on accident that they can identify their symptoms more frequently. And sometimes they do need a little bit of a push
yeah,
because
yeah,
even people who are aware of what's around them might not even be aware of what's going on in their own bodies.
yeah,
And I find that a lot with my patients that they don't recognize that they have some of the symptoms that they do.
yes,
So sometimes kind of drawing attention to it can be helpful.
yeah.
And I love that you say you're a little bit more blunt because I also experienced that. I joke that my filter broke in my accident, and I do say things a little bit more bluntly now. And
Hmm.
I usually kind of check in with my patients periodically, and I'm like, "How did that land on you?" Because I realize that sometimes I can be a little bit just more, blunt
Yeah.
than I used to be.
Actually, I don't like wearing shoes. I don't know if it's a sensory thing or what, but so I have fun socks,
Yeah.
and I have socks that it says my filter's broken.
Oh, I need to find that. That's
Yeah.
awesome.
Yes, because again, I talk a lot about vulnerabilities with my clients, and a lot of times I have higher vulnerabilities, and it is. I just have to take that moment to say, nope, I can't say that because that would be mean
Yeah.
and not helpful.
Yeah.
And being able to, just stop myself before I say something. And I mean, it helps because most of my job is listening. And so being able just to stop before I say something and really be aware of my own
Yeah.
things. Like, can't just say that, April. It's
Yeah.
not gonna
Yeah.
work. But yes, checking in with my clients is something that I do also because sometimes you have to be, more forthcoming and blunt because it's not gonna get through.
Yeah.
Like, I have a client who thinks her world is horrible. She lives in assisted living in a very small town, so she doesn't have a lot of social activities. She was injured at 16, so she's stuck in that teenager mentality.
Mm.
And I'm just like, "Hey, you have a lot of people that know you in this town, and you are very social." And she's like, "Oh, yeah, kind of pukingly positive too, so that kind of comes out too." Sometimes I have to apologize to my clients because I'm like, hey, I'm going to always usually see the bright side. And I mean, there are some things that just are not bright sides.
Yeah.
There's no bright side to them. For the most part, though, I can bring out, a glimmer of something good.
Yeah.
So,
Yeah. I like that glimmer idea.
yeah.
Yeah. So let's talk a little bit about the Montana Brain Injury Alliance as well. So you
Yes.
had experience with Minnesota.
Yes.
What kind of resources are available through Montana Brain Injury Alliance? What kind of things do you guys offer?
So we are in we are how do I say this? We separated from our executive director last year, actually, I think it's a year in April for many reasons. And as a board led alliance, there's 4 people on the board. Yep, 4, including me. The majority of the board members live in Missoula, which is 2.5 hours away from me. We meet online once a month. And finances, we are not federal. We do not receive any state or federal money, which is very prohibitive in being able to help the people of Montana. And we are fantastic. I love the group of people that I work with. We have, within the past year, have developed helmet giveaways that have been sponsored by an attorneys group in Missoula, and typically attend 4 or 5 helmet giveaways throughout the year throughout Montana. I mean, we are in a very small area. We're hoping to expand to more rural areas as we get to be a bigger board. But it's just, I think we're trying to stay afloat right now and
Mhm.
being able to support the people that we can with we have a helpline that people call into and can leave messages on and email us. But we don't have a lot of resources here.
Okay.
It's a very rural state again, and with such a small board and revamping our board, but also our organization has just been really tricky. And luckily, through the governor's TBI Advisory Council, we've been supported, maybe not financially, but with that support, it's really nice too. The grant, we've gotten some grants and we're able to give back to the communities that way. But I also think that just getting our name out there has been really challenging. The alliance has been in place since the 1980s, I think, and has ebbed and flowed in being able to do things. But yeah, we're transitioning.
Yeah. Yeah.
And hoping to be able to be more visual within communities and just do more events and
Yeah.
more helping giveaways. I think prevention is what we're going to focus on for the near future, and then education for professionals is what I'm really focused on, because I think that that's important too. Having people that are competent in treating brain injury is very important to me.
Yeah. Yeah. Absolutely. I was going to ask about education. Do you guys do any educational events or anything on website or anything?
So not on our website. When we do the helmet giveaways, we do some education on brain injury.
Okay.
Prevention is our biggest thing for that, especially with kids and their parents. We are focused on the certified brain injury specialist through the American Brain Injury Association, because I think that is it's a good program, and
Yeah.
it's pretty intense. But there's a lot of information, and being able to lead providers that way is more helpful. Our board is made up of 2 survivors, a parent of a survivor, and a sibling of a survivor. So, and then I'm one of the only medical professionals on the board. And so again, we're very small but mighty. We're making waves, and we're doing the best that we can.
Yeah.
There's always room for improvement, and right now we're doing the best we can.
Yeah.
So.
Yeah, absolutely. Just being on that TBI advisory board is a
Mhm.
great way to make that connection and kind of keep those resources
Yeah.
potentially available at least. So, yeah.
Yeah. Yeah, if I can just touch on the governor's TBI
Yeah,
council.
please. Yep.
It's an amazing council made up of mainly professionals. We have somebody from the VA and a lot of people from the state, the government level state. And so we are currently developing grant programs, because we have state funds coming in to be able to give to individuals and businesses that work with people with brain injury. And so that's really super exciting. And through that, maybe the Brain Injury Alliance will be able to apply for those funds and be able to expand our reach more. But I think that through the governor's TBI Advisory Council, we are going to make a lot more things available to Montanans, and hopefully be able to support people through education, but also resources too.
Yeah. Yeah, absolutely. In a perfect world, what would education look like for brain injury, do you think?
My gosh, in a perfect world, every single provider that was in the medical field and outside the medical field would be able to identify symptoms of a brain injury and be able to say, hey, I think that's from a brain injury. Or they would not confuse a concussion as just a one-time event that has no lasting effects. They would say, hey, it's a mild traumatic brain injury, and we are going to treat it that way. I say that kind of sarcastically, but that would be my
Yeah.
perfect world, is that people would be able to recognize and identify brain injury symptoms. I just attended an education on biomarkers, and that was very interesting. And so hopefully that'll be more readily available in the next 5 years. But also, yeah, just identifying brain injuries and symptoms of brain injuries, and then also people living with brain injuries not feeling guilty and shame that they have to rest, or that they have to take care of themselves, and it's just normalized. And not because I had this said to me, it's not all in our head. I mean, it's all in our heads, but it's not all in our heads. We're not making up the
Yeah.
symptoms. They're not excuses. They're
Yeah.
reasons for the things that we do and the things that we need. I think that's my perfect world, is that everybody would be brain injury educated. And
Yeah. 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 The it's all in your head thing is only true in the fact that your brain is inside of your skull. So,
right.
yes, in that sense, yes, it is
Yes.
in your head, but
Mhm.
to be honest with that, your brain touches every cell in your body.
Oh,
So,
absolutely.
it's not at all just in your head, and I kinda cringe a little bit every time I hear a provider tell somebody that, or hear a patient that said that they were told that, and
Mhm.
it's not. It's a very real experience, and we need to address it as such.
Well, and also just the different parts, like you touched on, the different parts of our bodies that
Mhm.
are controlled by our brain because it controls everything,
Yeah.
like bladder and bowel movements.
Yeah.
I work with people that have really significant issues with those things, and they're like, "I just don't know what happened." I'm like, "You had a brain injury. This is what's happening." And they're like, "Well, that can't be related. My doctor didn't say it was related." I'm like, "It's related. You
100%.
went from being perfectly fine before your brain injury to having so many significant problems, stomach issues,
Yeah.
digestive issues, and or yeah, just pain is
Reproductive issues.
yes, yes,
70 some percent of females have changes in their menses. Like,
yeah.
so many things change. Yeah.
I was having catamenial seizures because I was estrogen dominant, and nobody picked up on it until after I had my hysterectomy.
Mm.
And then my neurologist was like, I think that's what those were. And I was like, well, I mean, it's nice to know afterwards,
Yeah.
but I
It would
was
have been
feeling,
nice at the time. Yeah.
yeah, because my estrogen was so dominant that I was having significant health issues. And again, being told or insinuated that from professionals that I was making it up, that I was, the symptoms couldn't possibly be that bad. And yes, they were because almost everything disappeared after I had a hysterectomy.
Yeah. Yeah.
It's
Yeah.
kind of amazing.
There are so many things involved that aren't addressed on a regular basis,
Hmm.
that there's so much education that can be done to healthcare
Hmm.
professionals at any stage. Like, even in the emergency setting, I've had patients get put in 4-point restraints and sent to
Oh,
psychiatry because they got aggressive after their injury. Well, yeah, because they had a brain injury. So it's
hmm.
not a psychiatric breakdown, it's their brain injury, and we
Yeah.
kinda missed it right away. So, yeah, yeah. Yeah,
And
I know. So there's so many ways that I think that we can do some education much larger than just in Montana or Minnesota.
mhm.
But, yeah, we if as long as we keep connecting and making these little educational spots and teaching people the things that they need to know, I think we'll get toward that perfect world.
Yeah, hopefully,
Yeah,
hopefully, because I think that working with doctors that are open to being educated by their patients
yeah,
is helpful too. I can't tell you how many neurologists that I work with that I have a very rare headache disorder,
yeah,
and I know a lot about it. And I'm a very good advocate for myself because I've
yeah,
learned.
yeah,
And I've worked with neurologists who are open to it, and I've worked with neurologists who are very cut and dry. No, you can't be this knowledgeable because I'm the neurologist. And I'm like, well, you don't live in my body.
Mhm, mhm.
You don't experience my experiences. And I do know more than you because you didn't even know what this headache was before I
Yeah,
came in here.
yeah, yeah,
Because you'd never heard of it. But yeah, I think it's just being able to educate people, having again providers acknowledge that they don't know everything. They're experts in some areas. And that's really where I come from when I am with a client too is you're an expert on your life and I have some expertise on how your brain might function or what your mental health condition can do for or is doing for with you. But I am not you. I don't yeah. So being humble.
yeah,
That's another thing. In a perfect world, providers would be humble too.
yeah.
Some
Yeah,
are,
yep,
some aren't.
yes, that's, definitely true as well. I'll have patients thank me for everything that I've done for them, and I say, "Well, I just led you to the things you needed, and you did the hard work." So,
Right. Right. That's exactly what I say too. Because in
mhm,
DBT, again, I work with borderline personality disorder, which
mhm,
is a very difficult, a lot of trauma. And they're like, my life has changed because of you. And I'm like, I didn't do anything. You did all the hard work. I gave you
yeah,
the tools
yeah,
and then I guided you, but you did the work to make your life change. It's not me. I
yeah,
didn't do anything
yeah,
extraordinary
yeah.
other than be here for you.
I mean, that's
So,
pretty extraordinary in itself,
well,
so, yeah,
sometimes, yeah.
yeah. So if people are in Montana and they wanna find your practice, the Montana Brain Injury Alliance, where can they find those things?
So I have my own clinic. Unfortunately, I am full right now.
Of course.
If again, we could copy and paste, that would be great. But and I don't want somebody to go through what I went through just to get here. But
Right.
Mountain View Therapy is my clinic name. Brain Injury Alliance of Montana is again in Missoula. I'm going to look on my phone for the phone number because I don't. I won't be able to look it up quick enough.
Yeah, that's okay.
But
I'll find
Brain
it.
Injury Alliance of
Yeah.
Montana, it's easy to Google, and you can get the phone number from there. The helpline is also available. I apologize for not being prepared with that.
I will include it all in the show notes. We're good. Yeah.
Yeah. Yeah, but Mountain View Therapy is my clinic name. I have a hard time saying no, so if people contact me and if I actually can do it, then I probably will say yes, but I am very full. I am one of the very few people that does DBT in Montana
Mhm.
too. So for adults, so I get a lot of referrals with that. And for whatever reason, there's a few doctors that know who I am here, and I've been getting referrals from that. I'm not complaining. I love what I do.
Yeah.
If I could see 100 people a week, I probably would, but I'm at capacity right now.
Yeah.
So
Yeah, that's fair. No, that's fair. I've got a few people who have found out about me as well, and they send me lots of patients. So I know how that goes. So, yes, but I appreciate all the things that you are doing out there in Montana. And
well, thank
I
you.
will keep my fingers crossed and think all the good things that you guys get all the resources that you need to help
Yeah.
people in that
Yeah.
state.
It's going to be exciting.
Yeah.
This grant project that the TBI Council is working on is pretty exciting. We are in the beginning stages of it, just trying to get wording for applications. But once that gets rolling, it's going to be. I think it's going to be life changing for a lot of people, for a lot of Montanans, and a lot of companies and businesses that work within the brain injury community, because
Yeah.
it's a different kind of grant, and it's an ongoing grant. So it's not,
Yeah.
the money is just not going to run out in a year or two. So it's going to be fun. It's going to be fun to watch and be a part of.
That's awesome. That's awesome. I'm excited for you guys. So I hope that
Yeah.
all goes really well in your favor there. So as they
Yeah.
say
Thank you.
we've just been watching some Hunger Games. May the odds be ever in your favor on that
Yeah.
one. So yeah.
Thank you.
As we wrap up today, any last words of wisdom or advice that you'd like to share with our listeners?
Just not giving up, even if you have to advocate for yourself in multiple different ways. If you have a provider that's not listening to you or not working with you in the way that you feel comfortable, find a new one. I wish that had been told that early on in my recovery, because it would have saved me from a lot of heartache. I know I'm not everybody's cup of tea, that I don't work well with everybody, and I don't take it personally. And also it's important to advocate for yourself and get your needs met. Especially through medical providers, because again, they might have the education about brain injury, but they don't know the person or the patient. So, and make community within the brain injury community. Either volunteer or attend events. Minnesota has a lot of things like the Walk for Thought. That is a great one. Strides for Stroke in the fall. They have the community event with survivors, and so those are all really great. If you have any people that are listening in Montana, we have a few events coming up in August that are going to be fun throughout the state. But yeah, I think getting involved with people who have brain injuries is really helpful. It brings a sense of community and normalcy to our experiences, and it's just fun.
Yeah.
I love hanging out with people with brain injury, because I'm like,
Yeah.
you're my people.
Yeah. It's our tribe. It's our network. So
Yeah. Well, and it also is humbling too, because I work with a lot of people with severe brain injuries, and it helps me to be grateful that I am able to work. But also they're hilarious. Like, my one gal is hilarious.
Yeah.
And I mean, it's because she is blunt and she doesn't have a
Yeah.
filter. But I think just having those people in your life is helpful.
Yeah.
So anyway, I could talk your
Yeah.
ear off. So
100%.
sorry.
No, it's great. I have so much appreciated you being here today, April.
Well,
I wish you
thank so
guys
much.
all the best out there in Montana, and probably see you next time you come back to Minnesota.
Yeah, maybe.
Yeah.
Yeah. Okay.
All right. Thank you.
Thanks. Yep. Bye-bye.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, leave a comment, and share it so that others can benefit. Please also consider supporting the show by buying me a coffee. The link is in the show notes. You can also go to www.brainwellnesssolutions.com to catch the latest info and get links on all of the social medias there. See you next time.